Hi, I'm Marcus Cheatham, Health Officer of the Mid-Michigan District Health Department, serving Clinton, Gratiot, and Montcalm counties in central Michigan. You know, we really need to reopen the Michigan economy. We have jobs that are going away that aren't going to come back. We have businesses that are closing that are not going to reopen. The price of this pandemic has been very, very high. We need to get the economy going again. What I'm going to talk about now are the threats to reopening the economy and what you can do to keep your business safe so we can reopen successfully. But before I do that, I want to do a quick review of the data. I want to look at what's going on out there. This is the website of the Mid-Michigan District Health Department, and if you click on the banner, you come to some interesting charts and graphs. I'm going to blow them up so you can see them clearly. Let's start down here. This is the trend in the data since the beginning of the outbreak back at the beginning of March up until now, the beginning of June. You've got Clinton County in blue, Montcalm County in red, and Gratiot County in green. And so you can see that the first county to get hot to take off was Clinton County, had quite a few cases, has recently slowed down. Gratiot had very few cases for a long time and has now overtaken Montcalm as the second, of our three counties, the second, having the second highest case count. This is the data from yesterday. It shows 278 cases. We've had 279 as of today across the district. People wonder where these cases are. This is a map of the rate per 10,000, where red is hot, red is bad, and the green colors are cool areas with fewer cases. If there's no color, there's been no cases. So we do have some hot spots. Southern Clinton County was the first place to really have a lot of cases. Then we had Western Montcalm. More recently, Gratiot has had an increase in cases, especially Pine River Township, where we've had some outbreaks in long-term care facilities. There aren't actually that many cases in central Gratiot County. The population is low, but as a proportion of the population, it's become a hot zone, and cases have increased there recently. You can get a lot of information about the outbreak by going to the michigan.gov website. And if you scroll down, you come to this cool map, and it shows you the number of cases and deaths per county. So 139 in Clinton, 11 confirmed deaths, 74 in Gratiot, 10 confirmed deaths. It's 11 as of today, 66 in Montcalm, 1 death reported here. It's actually 2. The state of Michigan website and our website aren't the same because of the delay in the reporting. So it's not anything to get real excited about. You can get some really good information if you click here, cumulative data. So these are some really handy resources I want you to know about. Data about places includes information about the healthcare system. They don't have county level data. They report it by healthcare region. Gratiot and Clinton County are in region 1. You can see they have 1,500 inpatient hospital beds. Only 1,000 of them are currently occupied. So that tells you that there's plenty of strength and resiliency in the healthcare system in region 1 in case the outbreak should get bad. Again, Montcalm is in region 6, and there's the data for Montcalm. It's similarly good. So this is good to look at, especially if we have a second wave and you're worried about having access to care. Another thing that's really beneficial is looking at data about long-term care facilities. People worry about outbreaks in our long-term cares. So this has a listing of cumulative confirmed cases by county. So you can scroll down and see that in Clinton, Hazel, Finley, and Ovid have had none. Go down and look at Gratiot. And of course, we did have the 2 outbreaks there in Masonic and Riverside. This does not mean people are currently sick. This is the cumulative data. There's only a small number of people who are currently sick there. So that's good, useful information. So again, people are wondering, where are the cases coming from? Why are we continuing to see cases? They're trickling in. Is it only in long-term care facilities? No, it's not. We're continuing to have community spread. You're only going to get cases in long-term care facilities if people are moving around. It's the employees of the facilities who might be asymptomatic. They're screened. When they come to work, they seem fine, so they go to work, but they in fact do have COVID, and that's how it gets into the facilities. And then these workers come from all over the state. They come from Shiawassee County, Newaygo County, Isabella, everywhere, and travel to work in our long-term care facilities. And then if they get it in their place of work, then they spread it back to the community that they are coming from. So the community spread and the outbreaks in long-term care facilities, those are really connected. The next thing that I'm worried about, we've just had a case in a daycare, and that got us really thinking, if we're trying to get the economy open again, and we're having, so workers are needing to be able to have access to daycare, but we might be having outbreaks in daycares. I mean, think about that. So kids are usually asymptomatic spreaders. So if it happens in the facility, these kids are going to, bring it home to mom and dad probably without being symptomatic. Mom and dad are going to take it to work, and that's a threat to the workplace. Or if the daycare has to shut down, then the parents who need daycare so they can work, they might not be able to report to work if they have to stay home and take care of their kids. So I'm really worried about that as being a potential hot spot in the future. The last thing I want to show you in terms of data is this chart of the confirmed cases for our district, Clinton in blue, Gratiot in green, and Montcalm in red. And you can see we've sort of had 3 waves in the Mid-Michigan district. The first wave was almost all blue. That was Clinton County, the first place to heat up. The second wave was, and third wave were both more a combination of red and green. So the outbreak moved south from the urban areas in Michigan north into Clinton County, and then it pushed north from there into Gratiot and Montcalm. This line is the 5-day moving average of cases. We have been asked by the Supreme Court to advise our county courts about whether they can start to reopen by moving into what they call their so-called phase 1. And to do that, we need to see a continuous improvement in cases over time. And so we're using this line to help tell us if we're getting those kinds of improvements. So I'm going to stop sharing my screen for now. The main role of local public health is contact tracing. So we work very hard. We get reports either from laboratories or from healthcare providers of cases, and we contact those individuals, try to figure out if indeed they are a case, are they sick? And if so, then who have they had contact with? And this is really important to Michigan's fight against COVID-19. I want to be honest with you and tell you, though, there are some problems with this system, and that's so you can understand some of the threats to reopening Michigan business. For one thing, we don't get notified of all the cases. Physicians are always supposed to report, but they don't always do that. Another thing is that, we're rushing to stand up laboratories so we can test. We want to test everywhere across the state for COVID-19. But in fact, we've got labs that aren't connected to the statewide system because they've just been stood up. The other thing I just mentioned was people are often asymptomatic. So you don't know they have COVID. And then there's the problem of false negatives. So someone might think they're sick, go to get tested, get a negative result, and think that they're okay, when in fact they actually have it. And this is not a defect in the test. It's just in the nature of this virus that sometimes the levels are too low and the test can't detect them, even though later the person will become much sicker. So because of these threats, you need to take action to protect your business. We are seeing outbreaks in business, for example, in big box stores, in warehouses. I've already mentioned long-term care facilities, agricultural processors. We're continuing to see these little pop-up outbreaks, and so it doesn't represent a whole lot of cases. It feels like things are getting better, but it's a big threat to reopening the economy. There's a couple of other threats too. One is COVID exhaustion. People are just getting tired of this pandemic as it drags on. It's been the whole spring. I want you to think about the fact that pandemics like this often last years. So this is too early for us to let exhaustion set in, but it is. And so we're seeing people who are doing crazy things like piling into bars, shoulder to shoulder and talking in each other's faces and drinking together and staying in a tiny enclosed space for, hours at a time, breathing on each other. We know that's going to spread it to workers. So it's something we really need to be vigilant about. Another threat to business is liability. The lawyers are starting to test the waters for suing employers for negligence. In general, business lawyers think that businesses are covered under workers' compensation. It would be unusual for a business to lose in court, being charged with negligence. But one of the things if a worker gets COVID, but one of the things I'm going to tell you about is how to protect yourself from that. And another example of this is Kova Denialism. So we have people who outside of work talk loudly about how they believe COVID's fake news. They engage in a lot of risky behavior, then they bring that to work. I'm just going to tell you a very personal story. My wife works alongside someone who was a COVID denier, and she was convinced that the employer could not protect her from that person's possible disease, and so she decided to quit her job rather than run the risk of being exposed at work. And we are seeing this happening, obviously, especially with long-term care facilities. But it is a problem. So the good, long-serving, compliant employee left the business, and the non-compliant employee remains in the workplace. So employer, protect yourself. The best way to do that is documenting that you are following guidance on how to operate your business safely. So in a minute, we're going to get into exactly what that guidance is, but documentation is how you protect yourself from being accused of being a negligent employer. Before we get into the guidance, I want to help you visualize the difference between a safe and a risky environment. So one of the things I think most of us have figured out by now is that golfing is a safe outdoor activity. You stand 6 feet apart, you talk, you have a great time, play a round of golf. That's a safe activity. Well, what if you get in the car together and drive to the golf course and then drive home? That is completely unsafe. You do not know if your partner has COVID or not. They might very well be asymptomatic. And you're in the small enclosed vehicle for many, many minutes, going and coming from the golf course. What we say is that the risk of contracting COVID-19 is equal to the dose of the virus times the time that you are exposed. So people actually exuding the most virus right before their symptoms start. So that's the time when you get the biggest dose from somebody, is where when they're asymptomatic the day before they start having symptoms. And then the time. So if you sit in the car for a long time, um, then the exposure builds up and your chance of contracting it gets much, much higher. That's why you don't have to worry about someone jogging by you when you're walking on the sidewalk. There's no time for you to contract COVID in that kind of environment. So let's think about some other things. Churches and restaurants. We go to church to sit for an hour or 90 minutes. We're in an enclosed space with a lot of people. We sing. Singing is something that causes us to expel a lot of virus. So I do not think churches should be reopening for services indoors. That's a risky activity. Restaurants are being permitted to reopen, but if you think about it, you sit in that restaurant for a long time, you're indoors. I don't know. I think it's risky. Another risk that we're seeing to businesses is employees who rationalize away their symptoms. So they know they're not feeling well, but they say to themselves, but it couldn't be due to COVID. We've heard of people thinking it's morning sickness and all sorts of things and saying, no, I don't have COVID, when in fact they do. So employers, you really need to be careful about screening employees and making them really tell you if they have any symptoms at all and not let them rationalize it away. So if you have an employee who's a COVID denier outside of work or who is fibbing about their symptoms, can you discipline them? Probably not. That has not been tested. What is recommended for employers is to really emphasize training, training, training. Build up a culture in which your employees really respect this virus and understand the importance of being compliant. Okay, let's start to get into more details. So we are operating right now under emergency orders 96 and 97. By the time you see this video, we'll probably be up to 120 and 121. But basically under emergency order 96, we are still under stay at home. It's true that up north, things have been loosened up a little bit, but it's only for a few kinds of mostly outdoor activities. And even emergency order 96, which loosens things up north, still says, but unless an activity is essential, you really need to be staying home. And that's going to continue for a long time. Emergency order 97 added a lot of surprises for us. For one thing, it says employers must trace the contacts of sick employees, figure out who has been exposed by their sick employee. Up until this emergency order came out, I was telling employers, don't try to do that. You don't know how to do that. That's why you have a local health department. Call us. We will do that contact tracing for you. But emergency order 97 says employers have to do that. We still think the best way to do it is to contact us and have us help you do it. The other thing is you have to train your employees. You must train. And there's even details like this. You have to have a COVID supervisor on site in your workplace for people to report incidences to, possible failures of PPE or social distancing or things like that. So you've got to think about naming that individual and having them understand what their role is. So if you have any questions at all as an employer, please call your local health department. Ask to talk to a disease control nurse with your questions about, have we had an exposure? If so, what do we do about it? That should be the first place you go. If you're concerned about violations, if you're concerned about people not following emergency orders, you can call your local law enforcement or your health department. As you know, discipline is breaking down. We're less and less able to keep up with the problems that are happening out there, the crazy things that people are doing. But do report it to us if you are concerned. So now we are going to start looking at that good employer guidance that I was telling you about. So we're going to go to the website of the the Michigan Economic Recovery Council. It has, the website has a funky name, BLM COVID-19. Just Google Michigan Economic Recovery Council and you'll come straight to this web page. So as Michigan just started thinking about reopening, they realized people didn't want to take advice about the economy from elected leaders. They wanted to hear from business to business. So the governor created the Michigan Economic Recovery Council, and here's who's on it. So this is the healthcare advisory group, and it has the leaders of most of the major healthcare systems. If you're from Montcalm County, you recognize the name of Tina Fries-Decker. She's now the president and CEO of Spectrum Health, the whole kit and caboodle. She started out in Greenville, but they've also got, Henry Ford Health System, Munson, all of the universities. So this is just a really powerful group. And then on the business advisory group, how about these names? Mary Barra from GM, Dow. We've got the Small Business Association, Steelcase, Meyer, just, who's who of Michigan business. So the state was really serious when they created the Michigan Economic Recovery Council. And then here is their guidance. So it's broken down into sector. So manufacturing, retail, healthcare, entertainment, and then under each of these, they have a variety of subsectors. So for example, under office, retail, and residential, you've got your retail, and that's what I want to look at right now. So when you click on that link, you come here, and this is the detailed guidance for the retail sector. And in the Merck model, and this is already starting to be familiar to a lot of us, they have 8 things that they look at in areas of, prevention and recovery from COVID. So planning, facility screening, we're all seeing screening happening now, PPE, social distancing, disinfecting, and here's where the case monitoring comes in, where they start to ask employers to trace those cases. They still suggest us to continue temporary closures. Our health department is not bringing people back into the office if they don't need to be in the office. You can do that too. And then continuing travel restrictions. This has been loosened up a lot. If you think about it, Michigan is still one of the hotter places in the country in terms of COVID. So if you want to go to Ohio to visit relatives, you're maybe going from a place with more COVID to a place with less. So travel's been loosened up a little bit. So and then they take each of these 8 and take a deep dive into it. So let's look at, for example, area 2, entry and health checks, and scroll down to that. So here we go. Oops, went too far. There it is. They tell you exactly how to set this up. They tell you to, reduce congestion at entry points, screen your employees, screen your customers, stagger schedules so that you don't have congestion in the office, issues around checking for fevers. You can do that without a thermometer, just by asking people subjectively how they feel. They actually, give you nice pictures of what it's supposed to look like, signage. Here's spacing vehicles in front of a store, spacing customers coming in, and of course we've now all seen this ourselves with our own eyes because we've gone shopping and we've seen how the stores are doing this. But this is just really good guidance about how to go about doing that. Now on the Merck website, they do have other stuff. That's kind of cool. You might want to look at. So if you scroll down to the bottom, they have some really interesting technical papers by one of the people that was on the council, Deloitte. They have, automatic contact tracing tools you can use. These, PwC coincidentally makes these automatic contact tracing tools. Deloitte would love to consult with you about planning for your business. So there's a little bit of self-promotion going on here, but the stuff is, it is interesting and I think important. Now there's lots of other guidance that has come out recently too that I want you to know about. So LEO, Labor and Economic Opportunity, has published a whole raft of OSHA guidance. Look at these sectors: construction, industry, manufacturing, office, retail, labs. There's your entertainment again, healthcare. So broken into sectors similar to the Merck guidance with details under each area. Excuse me. The thing that's interesting about the OSHA guidance is it's come out since the most recent emergency orders. And so it aligns better. So it has details about those things like contact tracing or training, COVID supervision and stuff like that, which I think is really, really helpful. The whole question of how do I train my employees? For example, they provide this nice video. Let's listen to a minute of it. There you go. So this is a 15-minute video you can play for your employees, and you will be able to check the box that, yes, I am following the guidance as required. I'm doing my training. If you implement what we just saw in the Merck guidance or in the OSHA guidance, and you document that you did that, you're covered. If you screen your employees, just keep the records of the screening tools. You don't have to send them to anyone, but just keep them on hand in case you have an employee that says, my boss wasn't screening. So I hear complaints all the time that there's no guidance for businesses about how to be safe during COVID. Here's two great resources. Go to them and use them. Okay, and wrapping up, I just want to talk about what I expect for the future and what the health department's position is going to be on things. If you call us with complaints or questions, if you call us to say that you think we're being too tight and we should loosen things up faster, I'm always going to say the same thing. First of all, we're part of government. We're following the emergency orders, and you should be too. Secondly, follow in operating your business the Merck guidance or the OSHA guidance, and or both. They're great. Document that you're doing that and tell other people that you're doing that. If you have some kind of a safe, socially distanced event and you want to talk to people, so like curbside sales of products, talk to people about how curbside service is following Merck guidance and OSHA guidance about safe ways to interact with customers. Reference the two forms of guidances so other people will know they need to do that also. You'll be helping the health department do its job if you promote that guidance. Again, call the health department. If you have any questions, ask to talk to a disease control nurse, ask for environmental health if you are worried about complaints. I want to end, I'll tell you, I'll be honest. My employees are kind of discouraged. We're in public health, and we know that what normally happens in a pandemic is that people reopen too soon. And so you get a second wave. If you look back in history, this is what's happened historically, and we seem to be acting the same way again. So we do feel discouraged. I just tell my employees, think about all the good things public health is doing. Think about all the supplemental nutrition we're providing to families that are in trouble because breadwinners have lost their jobs. Think about how we're helping businesses reopening reopen by getting out there and permitting and helping restaurants that can open to reopen. We're trying to get the economy going again to all the services we provide for kids at this time. There's lots we can do to help our communities, even if some people are moving too fast. And then to you, as an employer, as a community member, I want to say two things. One, you can keep your family safe and healthy. You can do that by staying home and when you're out, following safe practices. And if you're an employer, you can keep your business safe by getting this guidance, learning about it, and applying it in your workplace. You can't keep COVID out forever, but if you get a case in your business, you can jump on top of it and shut it down right away. So that's it for the Mid-Michigan District Health Department. We will have more videos coming up as we have more to report. Thank you very much.